Hey guys, welcome to my channel, and today we're talking about sickle cell disease. Let's get straight to it. There are almost 4.5 million people living with sickle cell disease. There are 43 million people who are carriers of the sickle cell gene in the world. About 80% of those people live in sub-Saharan Africa. Sickle cell disease is a group of genetic disorders of the red blood cells. For the purpose of this video, we are going to focus on sickle cell anemia, which is the most common and the most severe form of sickle cell disease. Red blood cells with the normal hemoglobin are usually smooth, they are disc-shaped and flexible. These features make it easy for them to glide easily, to move easily within the blood vessels. On the other hand, red blood cells that have sickle cell hemoglobin have lost that nice and round shape. They are stiff, they are hard, and they are sticky. This makes it difficult for them to glide through the blood vessels. So it's hard for them to transport oxygen throughout the body to deliver nutrition. Because of these characteristics of the sickle cell hemoglobin, sometimes they get clamped up, they get attached, they stick to each other, and they cause what we may refer to as a jam within the blood vessels. When this happens, blood is not able to flow easily, and nutrition and oxygen is not able to be delivered to the tissues as it's supposed to be. And this causes a lot of pain, which is commonly referred to as crisis pain, which is severe pain that people with sickle cell disease go through. This picture here shows us how sickle cell disease is passed on to the child. It is a genetic disorder. It is inherited from the parents. It is nobody's fault. There is nothing that you did or could have done to get it. It is just inherited. Therefore, for a child to be born with sickle cell disease, each of the parents must have a copy of the sickle cell trait and pass it on to the child. Therefore, as you can see in this picture, they have a 25% chance of having a normal child. They have a 50% chance of having children with sickle cell trait, which is not the disease. The sickle cell trait, when you have the sickle cell trait, you are a carrier. You don't have the disease. You don't get symptoms from it, but you may pass it on to your children in the future, especially if you have a child with somebody else who has the sickle cell trait or the disease. And they also have a 25% chance of having a child with sickle cell disease. We need to create more awareness about this sickle cell anemia. Sickle cell anemia impacts the individual in more ways than we can fathom. It affects your brain, your eyes, your skin, your blood vessels, your heart, your lungs, your muscles, your joints, your intestines, your spleen. The spleen is supposed to protect us against infection, but once it's infected and damaged, no wonder they keep getting multiple infections, recurrent infections, and those lead into crisis pain over and over. If you're planning to get pregnant, your pregnancy is impacted. If you are a man, you get this condition called priapism. My goodness. No wonder in sub-Saharan Africa, 80 to 90%, yes, 80 to 90% of children born with sickle cell anemia do not get to see past their 5th birthday. They don't stand a chance. So, what are some of the symptoms that people living with sickle cell disease experience? One of them is anemia. Anemia happens because the sickle cell, the sickle cells constantly need to be replaced because they are easily destroyed, they easily rupture. Their lifespan is about 10 to 20 days versus the lifespan of normal red blood cells, which is 120 days. So when they're constantly destroyed, needing to be replaced, they leave that vacuum, causing anemia. Another big thing is pain, and usually described as crisis pain. It happens because the sickle cells clump up together. They're sticky, like we talked about. They're sticky, they're not as flexible, they're not as smooth. So they cause that jam in the blood vessels. And when they cause that jam or blockage, you cannot get now blood full of oxygen to nourish cells. So this causes a lot of pain. Another symptom is swollen hands and feet, and especially in infants. This is actually one of the ways of getting the little ones diagnosed, because as a parent you'll notice that the kids are always fussy, crying, maybe not eating or sleeping enough, but also the swollen hands and feet. And so you bring them in, they get checked, they get diagnosed with sickle cell anemia, sickle cell disease. Another one is stunted growth or delayed growth. And you'll see them that when you look at them, they're usually smaller looking compared to kids of similar age or even adults of similar age. So those are some of the most common symptoms that you will see in people living with sickle cell disease. Treatment options that we currently have for sickle cell anemia include medications, blood transfusions, and yes, we do have a cure. The medications that we currently use are for little ones. They recommend and they give daily antibiotic like penicillin to prevent infections, because infections are a trigger. We also have this medication. It's an old chemo drug. It's called hydroxyurea, that has been shown to improve mortality in sickle cell. It reduces the episodes of crisis by up to 50%. So it's a daily medication that you take. It's a daily pill. Others include folic acid. Folic acid helps to stimulate the bone marrow to produce red blood cells. Pain medications at home, from mild pain medication to stronger pain medications. In the hospital, if someone was to be in crisis and go to the hospital, treatment includes pain management with opioids, IV fluids, to boost your hydration, because hydration is a trigger. Also, your daily medications that you take at home, you will be getting those in the hospital as well. Sometimes, some cases may need blood transfusion. So you would get that if you need that. And then the cures that we currently have are stem cells and bone marrow transplants. And those are not done as frequently as you would expect because, like any other transplant, they pose great risks, such as rejection. So I haven't seen it done too much or as much as you would think. And they're doing, I think they're still testing gene therapy, where they edit your genes so that, the new genes, I don't know too much about it, but the new genes would help produce normal red blood cells. And in Ghana, they're trying something that can fix the sickle cell in vitro, like before babies are actually born. They can change that. So those are the current treatment options that we have right now. So what next? Now you're going to have to know your status. Yes, they say when you know better, you do better. So it's very important to know your status, whether you have the sickle cell trait. Once you know the status, assuming you have the sickle cell trait, educate yourself. Educate yourself and what that means, because one of the most important things is when it comes to choosing partners. If you don't want to pass that on to a child, then you're not going to have children with somebody with the trait as well. A time is coming that when you go out on a date, in addition to those other questions you might want to know, like, what do you do for a living? What car do you drive? You may have to ask what type of red blood cells you have.
Do me a favor, please. Get out of here. Get out of here, man. Shit.
Yes, you will need to ask that. What type of red blood cells do you have? Yes. Next thing you will need to do is, if somebody has sickle cell disease, first of all, being that sickle cell anemia is most prevalent in sub-Saharan Africa, you would expect that it's a requirement for every newborn, and I hope it is, that every newborn is tested for sickle cell anemia at birth. It helps because if they turn out to have sickle cell anemia, then it saves yourself a lot of headache, and as a parent, you'll know how to take care of them. You'll educate yourself on this disease, and you'll know how to take care of them and save them years of agony and pain, because it's possible to live and thrive with sickle cell disease or anemia. So if you are a parent and your child has turned positive for the sickle cell anemia, what are you going to do? You're going to learn the disease and then know what triggers the sickle cell crisis pain for this child. If it is dehydration, make sure they are well hydrated. If it's poor nutrition, make sure it's a balanced diet that this child is able to have. If it's poor hygiene, clean up all the time. Make it your job, make it your purpose. Clean up, prevent these triggers. And for young children, they like to put them on antibiotics, daily antibiotics like penicillin as a maintenance dose. As a parent of this child, stay on top of vaccinations because of the frequent infections, and the triggers. Stay on top of their vaccinations. Get them vaccinated. They're at risk for meningitis, among other things. If you are an educator and the child is, school-going age, be patient. They're going to miss a lot of days from school. And I know they feel bad already because no child likes to be left behind in class. When you talk about things and they're clueless, they don't like that already. So don't be too hard on them. Of course, expect the same, but be patient with them. Give them whatever resources they need to be able to catch up with the rest of the class. If you are a teenager or a young adult, you know what's good for you, what's not. At this time, you know what triggers you. Avoid the triggers. Maintain high standards of hygiene. Avoid reckless behavior, such as drinking. Alcohol dehydrates you like nobody's business. Avoid alcohol. And if you must have a bottle, then hydrate like crazy. Hydrate yourself. Know what triggers you and avoid that thing. Sickle cell requires a lot of oxygen as it is. So avoid things like climbing Mount Kilimanjaro. Not everybody has to climb Mount Kilimanjaro, especially when you have sickle cell disease, because at a high altitude, you won't have enough oxygen. That's going to send you into crisis. And who knows what crisis is going to put you down. So avoid reckless behavior for someone with sickle cell anemia. Stay on top of your medication regimen. Have a doctor that you see frequently. Remain in contact with the doctor. If you're fortunate to have a hematologist, maintain that relationship even better with your hematologist. Stay on top of your regimen, your treatment. If you're on hydroxyurea, take it every day. If you're on folic acid as well, take your medicines every day, religiously every day. Hydroxyurea has been shown to cut episodes of crisis by 50%. It significantly reduces episodes of crisis. So take it. Just take it. And when you know you're feeling better and the medications at home, including the pain medications that you're taking at home, and you know you're in crisis, don't wait. Go to the hospital where you can get acute care and you can properly be managed. I asked a friend of mine living and thriving with sickle cell anemia, what are some of the challenges he has faced or he faces as somebody living with sickle cell anemia. And I also asked him to describe his pain, and he said, it's the most excruciating pain you can imagine, like an 18-wheeler truck rolling on your chest and joints back and forth. It's pain I would not wish on my worst enemy.
Let it all
The crisis pain is real.
out the window.
It is real.
No smoke in
Another
my
challenge he faces is being judged that he just wants to take pain medicine, narcotics, or that he is addicted. And that goes for a lot of patients with sickle cell. There are people who are addicted to the medication. I mean, they've been taking this medications for how long? We have people coming to the hospital after a surgery, 1 week, 2 weeks, and they're addicted to opioids. So imagine having taken it for that long. And even for those who are addicted to the pain medicine, just because they're addicted to the pain medicine does not negate the fact that they have crisis pain. And over time, having been on opiates for a while, you build tolerance. So you're going to need higher and higher doses compared to somebody who is opioid naive. So if you are a medic, recognize the crisis pain is real and treat it accordingly. Don't let one or two people that you've seen just coming for pain medicine keep you from treating this patient well, because like I said, crisis pain is real. It is real. Young people going through this already have issues with missing things. They miss the fun activities with their peers. They miss class. They fall behind in a lot of things. And it's difficult to keep explaining to your friends that you're sick, because you're going to be sick a lot of times until you figure out what works for you. And they may not understand it, because not a lot of people understand what exactly is sickle cell anemia. It is so much bigger than pain medicine. Yes. So let us be supportive. This young people are dealing with maybe even self-esteem issues, a lot of emotional challenges as well. So wherever you are, even if you don't have the trait or the sickle cell anemia, be supportive. If you have a friend who has it, go and educate yourself more about this condition and be supportive. All you could do may be just holding their hand, but that is good. Be supportive. Thank you guys for watching. I hope you have learned something. I will see you in the next video.